Welcome to the Acupuncture Outsider podcast. My name is Richard Hazel, and in the time it takes for you to commute to or from work, I hope to have shared something of interest about orthopedic acupuncture using motor points, trigger points, myofascial slings, neurofunctional acupuncture, segmental treatments, anything that crosses my mind that seems to be of interest. I hope you'll enjoy it. Hello and welcome to another episode of the Acupuncture Outsider. This is Richard Hazel, and today I'm going to just do some case reporting. I'm just going to talk about some tough cases and a little bit about treatment for those tough cases. And I think hopefully it will be of some interest to someone who has similar cases. Yesterday, I saw a patient that I told you about, I believe, last episode. And her whole spine had been fused, L1 through 5 through S1 area. She has metal in her back, so even just going past the skin at the spinal erector, I could tap metal. She has a skin sensitivity in her whole upper torso area. She has to always wear a t-shirt because just the fabric brushing against her skin was so unbearable. Same with her low legs. When she came in, she was referred by a patient of mine who's a doctor, and she could not stand up straight, and she was in excruciating pain all the time. And she really had just resigned to having to live like that because there were no more surgeries to be done. And there really wasn't any advice that was given that was going to help her. She had already done everything that they had suggested. So she was a tough case, and I was a little worried that this might be beyond my ability to help her. But working through things like releasing the psoas, using motor points of the lumbar area, the QL, the erectors to what I could get. I put needles into the erectors without electric stim because I knew I was going to be hitting the metal. And the QL was a little tough because on the left side, she had a spinal cord stimulator that no longer worked. It was horizontal, about the size of like maybe a big cigarette lighter, those disposable cigarette lighters. About like that, kind of flat, and it was really tough to get a needle into the QL to stimulate the motor point of the QL. So I kind of had to stick a needle just above the pelvis and below the stimulator. Normally, I want to go about 1 centimeter above the iliac crest to get the best motor point stimulation for the QL. Worked on her glutes, piriformis. I don't think there was anything wrong with her legs that I had to do. I do believe, when she was face up after doing psoas, I had realized how tight her rectus femoris was, very ischemic and tight. So I'd worked on that. The second treatment, I started bracketing for the neuropathy, the upper body neuropathy. The lower body it was too excruciating for her to even have me push on those muscles. We're leaving that for later, for last. But so yesterday was her 4th visit. And I usually tell somebody in chronic pain, give it 3 to 5 sessions before you decide it's not working. Because by 3 to 5, I expect someone to feel some improvement. But on her 3rd visit, right before my last podcast episode, I dry needled the crap out of her gluteus medius and piriformis. She had trigger points in all three locations that I normally find for the gluteus medius, which is going almost straight up and down right above the greater trochanter. Then in the midway, the one that usually causes some low back pain, and then farther in, the one that ends right at the top of the sacrum and points directly at the L5 area. That one gives a lot of pain that duplicates a discogenic pain, very L5 or sometimes SI joint kind of pain, but that's usually piriformis. So I got through all of those trigger points, and I knew it was horrible for her. And because she lives with such a high level of pain, she tolerated it better than, I don't know. It's so rare to find somebody who says, I'm okay, go ahead, do what you need to do. And she just got through it. I feel like it was probably similar to if you've ever had a tattoo for, where you had to sit for a few hours. It gets pretty uncomfortable. She got through it. She felt huge relief walking out. But I was hopeful, didn't know for sure if some of those trigger points might still be active in there and that she might still be in pain. So she came in yesterday and all of the trigger points were deactivated. She had zero pain, no matter where or how hard I pushed on the gluteus medius and piriformis. She said, my pain now is just here, and she points to her low back QL area. So of course it was really locked up trigger points. So I said, okay, I think we got to dry needle it. How sore were you after the last session, so we know how long it's going to be for you to feel better? She said, oh, I was really sore for 2 or 3 days. And I said, okay, so are you okay with this? She's like, yeah, absolutely. Let's do this. So I dry needled her QL on the right, and man, it was like a rock. It was just, there's no way for me to describe it. It felt almost like I was questioning whether it was I actually pushing on the cage that fused her spine, or was it really the QL? And it really was the QL, because after a few twitches, it started feeling like supple muscle. And I just kept at it. And she, I asked her permission to continue because I knew it must just really be horrible. So she got through that, and she didn't even flinch. She was fine. She said, it's fine. If you hear me, it's just because it surprises me when it jumps. I'm fine. Keep going. On the stimulator side, I found that I could push my thumb under the spinal cord stimulator. It's kind of floating around in there, in the fascia. So I was able to push my thumb under and locate the outer border of the QL. So actually, dry needling the QL was easier than stimulating the motor point, because I could basically move the stimulator up out of the way and get my thumb against the QL and get some good release on the other QL. And she really felt a huge improvement. She felt like she could stand up straighter. And she had no pain walking out. And I said, of course, you're going to be sore. And she's fine with it. She knows how it works now. But that was her 4th session. She's doing really well. And she said the sensitivity in her upper body has decreased a lot. So I did more bracketing at just random spinous processes that I could get to above the bra, below the bra, probably 4 different brackets. I tend to skip over and not try to do every single one because the multifidi are crossing. They're long enough to go past two vertebrae. So I just try to put them where they will go, and hopefully that's continuing to improve. But I wanted to update on that because that's her fourth visit, and probably one of the most challenging pain cases I've seen in a while. And I have to say, I'm so happy she's doing so much better. She was able to stand at her son's her son's wedding, um, since the last treatment. She said yes, she had to take breaks and sit, but she was so happy to be able to stand and officiate. She got her, whatever that is, where you get the license to be able to marry people. So she was able to officiate her son's wedding, and she stood for it. And that was her biggest goal. So, so she's doing really well. I'm so happy about that. And then I had a couple really tough sciatica cases, both on the same day, a couple weeks ago. One guy is about 68 or 9, and he was in horrible sciatic pain, and really was limping and could barely stand up. And he tried to the doctor wanted him to get an epidural, and the soonest they could get him in was like a month away. So he's scheduled for an epidural like a month out. Like, let me not go down the whole pathway of how we have such a shortage of doctors now that it's all those horror stories that people like to tell about socialized medicine and people waiting to see doctors. It's happening here in the US. Try to see a specialist. You'll see. You'll be on their schedule for a month or two out. So anyway, and we pay way more than the people who are also waiting with socialized medicine. So he can't get an epidural for a month, and he is miserable. And so his friend who comes to see me tells him, you must go, at least for palliative reasons. Even if you need the epidural, this can help you get through the next month. So he came to see me, and he couldn't lie flat. He was in excruciating pain. I couldn't even prop up his hip a little bit to make it comfortable for him to lie flat. It was just horrible for him. So I treated him on his side, deep rotators and glutes, hamstring, peroneus longus, and I was able to treat his psoas. But when he walked out, he was not pain-free. He still had some tingling and still had some sciatic symptoms. And I said, this is probably the most we can do today. Hopefully I released enough that the next time I see you, you'll be able to lie flat, and I can start trying to deactivate the lumbar area, like the spinous process of L5, S1, because that's going to give you lasting results. I got to deactivate that, but on your side, it's just not ideal. It's not a good, just difficult. He had a hard time holding still too. I should have mentioned the reason I couldn't really do the segments on his side was because he just needed to keep shifting position because he was just miserable. So the second time I saw him, he came in the afternoon. He says, I feel much more warmed up now. Yes, last time it was the morning. Mornings are the worst for me. So he came in the afternoon. He was able to lie flat. I was able to work on the lumbar area, all of the muscles I usually treat, get some good trigger point release for piriformis, deep rotators. Everything was doing pretty good. And the last thing that was hurting him at the end of the second session was his low down peroneus brevis And I did spot treat it with the pointer, but then I was surprised because I almost never see Peyronie's brevis involved in a sciatic patient. It's always Peyronie's longus. But I asked him if he has any sort of numbness because I thought, what if it's like, what if this is sensitized because of previous like superficial peroneal nerve thing? I said, do you have numbness in the top of your foot or the front of your leg? And he said, yeah, both sides. I've had that for a long time. And I said, oh, do you get restless leg? Yes. He was surprised that I knew that, but you see about 50% of the time they go hand in hand. So I said, okay, this is what's up. This is something that was pre-existing and now it's really irritated by the sciatica. So this time I saw him for his third visit. By the way, he's doing way, way better. And he said, really, right now, it's just the low leg that hurts me at night. Because once I'm warmed up and I'm walking around, I'm good. But the low leg at night really aches. And I think it's that peroneus brevis. So I was able to treat that with a good 10 minutes of electric stim, and it felt way better at the end of the treatment. I probably did get a couple more twitches out of the piriformis. Continue to bracket the L5S1. I think he's going to do really well. And when he got up, he had no symptoms, no sciatic symptoms. His leg felt better. He said, listen, do you think I should consider postponing my epidural? And I said, listen, I'm not going to tell you if your doctor, wants you to do something. All I'm going to say is if you're not having pain or sciatic symptoms, why are you getting an epidural? Hold your appointment. Keep that in your back pocket so you have it. But see me next week, and then let's rediscuss. And maybe you just want to postpone it indefinitely because if you don't have symptoms, why would you go through that? And then if you are feeling better and you get an epidural, then you don't really know which helped. And I would rather if the acupuncture helped or the epidural helped. So I say, hold your appointment and then let's discuss after I see you next week. So I think he's going to end up being able to postpone indefinitely and just have that so he knows if he has a major flare-up that's always an option. The other tough sciatica case is a woman about 40, and she actually has I don't know if I should say it's a disease. She has something called myotonia, and the muscles can get like rock hard, locked up for no apparent reason. But I've treated her before, and she responds really well to the motor points. And but anyway, she had sciatica, and it was really bad sciatica, and I even had to get into the quadratus femoris for her because that was so locked up. It was also entrapping the sciatic nerve. So I sent her away after her first visit, not knowing if she was going to be okay because she still felt like she was having some discomfort and a little bit of sciatica. And knowing her condition, I also wasn't trusting that the muscles would stay released. So anyway, I saw her this past week, and I had not seen her for a few weeks. So I was nervous that she was just miserable, and she came in. She said, "Oh," I said, "I can tell you're limping, so I know you didn't get better from the last treatment." She said, "Oh yes, I did. I was doing great after that treatment. I was feeling great. I screwed up. I decided to skateboard. I went skateboarding, and I injured myself again, and now I'm having a lot of sciatic again. So So you just got to know. If you knew her, I mean, she's got like, she usually has different colors in her hair. She's very cool. She got lots of tattoos. I like her. And she's always skateboarded her whole life. I was like, if I try to skateboard, I'm going to break something. But she's skateboarded her whole life. So at 40 something, she feels very comfortable skateboarding. And she does martial arts. She does all sorts of stuff. But anyway, so I treated her again and she walked out feeling great. And she said, I'm going to take it easy now. I'm not going to skateboard. I'm going to go easy. I'm going to let it heal, like let things calm down. So I'm hopeful she's going to be doing better. But I wanted to tell that story because it was kind of interesting. And yeah, you just never know. But I feel really, really good that my protocol for sciatica seems to really help people quickly, um, uh, almost every time. Even in times when I thought, no way is this person going to be better because they're just so miserable. Many, many times it really does. I would say that if you don't get better from my sciatica protocol, you should actually be getting imaging because the ones who don't get better are the ones who ended up needing surgery. And it's unfortunate, but that seems to be the case. If you're not responding from me treating the muscles, you probably have something that needs a more serious intervention. So those were the cases that I've been thinking about that I'm really happy about. Oh, and just so you know, today I am publishing on Podia my 4-day Sydney course that I just taught this past spring. The videos, it's 4 days of video lectures and demos, hours of demos, hours of lecture. It is called Motor Point Acupuncture Mastery, using Yonda's cross syndromes for shoulder and knee pain. And then the advanced day is more nerve entrapments, migraine headaches, which the way I'm treating is as occipital nerve entrapment, treating sciatica and a couple pseudo sciaticas that are other nerve entrapments like the superior cluneal nerve or the superior gluteal nerve, how to differentiate and assess, palpate, always palpate, and treat. So it's got some good stuff in there. My migraine protocol is also winning all the time. I'm really happy about it. That's in this course. So if you're interested, the link to Podia is always in the podcast episode description. But yeah, I'm happy with this course. I just finished uploading everything and reviewing. I had to review every single video so that I could index it. And so it's a good chance for me to like kind of watch myself and hear what I say. And I'm happy. I'm happy with the way the lecture came out and the demos. So check that out if you're interested, especially if you want to do just if you need help with something like migraine headaches or sciatica, definitely check it out. It's worth the price of the course just for those 2 approaches for day 4. I do a little more dry needling in this course than I remembered, but I always have to dry needle the upper traps for migraine patients. But, getting into things like piriformis, coracobrachialis, deltoids, what else did I dry needle? TFL. There's more than that, but yeah, a little more dry needling than I remembered. But when I demo, people have real problems. They ask to be the demo person because they've seen my presentation. They say, that's what I have. Can I be the person that you demo? And so you get to see in the demo how I maybe switch things up and add something maybe a little bit of trigger point release, because it's a real person with a real problem. So you see kind of how I not only demo the motor points, but then actually treat the real problem. So that's always nice because it's usually a little addition to it. And then it's nice for people to see the assessment before and after, and get the live, like legitimate feedback about how they feel post treatment. So yeah, so check that out. I just posted a little preview on YouTube if you want to check that out. I guess that's it for this week. This is episode 100, I believe, which is pretty exciting for me because I wasn't sure if I could be consistent about recording these episodes. I wasn't sure. I thought maybe I'll get burned out. Maybe nobody will listen. But thanks to your feedback, I have felt encouraged to continue to record these episodes. And hopefully I can continue to find new topics so that it doesn't become too repetitive. But it's been a couple years now, and somehow I'm still finding new things to talk about and to discuss. So thank you for your support. Thank you for listening. And thank you for sending me the kind feedback, because otherwise I really don't know what you think. And I just have to hope that somebody out there is listening. Someone from Indonesia thanked me recently, and I really appreciate that. I love knowing that there are like places in the world I've never been, and people are listening to my podcast. It's really great. Okay, so have a great weekend, and I will talk to you soon.